Have you ever thought about the far-reaching effects of war? Beyond the immediate devastation and loss, there are invisible impacts, especially on the most vulnerable among us, pregnant women and their unborn children. Today, we delve into a significant study that reveals the hidden toll of conflict on public health, particularly on maternity and neonatal health. The setting for this research is Gaza, Palestine, a region with a history of military attacks and a consequent rise in reproductive health issues. Since 2011, Gaza has experienced a significant increase in the prevalence of preterm birth, low birth weight, and birth defects. This increase cannot be explained by known factors affecting reproductive health, which prompted researchers to look beyond the obvious. In 2012 and 2014, two military attacks introduced new risk factors to the population. Among these were contamination by teratogenic and carcinogenic heavy metals from weapon remnants, ongoing impoverishment, and impaired waste management. What's particularly alarming is that mothers exposed to military attacks had a higher load of these harmful heavy metals than those unexposed. Even more disturbing, these heavy metals can pass through the placenta, directly affecting the unborn child. The study found that proximity to unmanaged waste predicted instances of preterm birth and birth defects. Women living in these areas had the highest load of heavy metals. A poor diet was also found to predict low birth weight. The impact of heavy metals on fetal development is not yet fully understood. We know they can affect DNA, signaling pathways, and organ development, but the extent of their influence remains a mystery. What is clear, however, is that there is a critical lack of systematic monitoring of reproductive health and heavy metal contamination in war-affected areas. Evidence of this contamination has been found in wound tissues and bomb craters in Gaza. Since Operation Cast Lead in 2008 to 2009, birth defects and perinatal mortality have increased. Specific war remnant heavy metals have been found in excess amounts in babies with birth defects and preterm birth. This research paints a disturbing picture of the hidden impacts of war. These are consequences that linger long after the smoke clears, affecting generations yet unborn. It's a reminder that the health effects of war extend far beyond the battlefield and can continue to harm long after peace treaties are signed. So what can we do? It's time to raise awareness about this overlooked aspect of war and its effects on public health. We need to advocate for systematic monitoring of reproductive health and heavy metal contamination in war-affected areas. We need to push for better waste management and improved nutrition in these regions. But most importantly, we need to remember that when we talk about war, we're not just talking about politics or territory. We're talking about people's lives, their health, and the future of their children. So stand up, speak out, and support efforts to improve reproductive health in war-torn regions. Because every life deserves a healthy start, no matter where it begins.